Welcome to Going the Distance with Go Long. I am Jill Consor Beck. Go Long focuses on helping women over 40, particularly women with autoimmune diseases, manage their time and get accountable to themselves around just empathy for their struggle, pragmatic solutions, and optimism that they can make the changes that we want to make. On this show, we like interviewing people on topics that are pertinent to this demographic. And today's guest, I am really excited about. We're talking to Dr. Debbie Sumner, and she used to practice medicine clinically, and now she's doing something tangential to that. And I'm so excited to have her here because she has such this unique perspective. So, Debbie, welcome to the show.
Thanks so much, Jill. It's so great to be here, and I'm really thrilled that you got to include me on your podcast.
Yeah. So, tell everyone how you got here.
Uh, I can talk very tangentially, as you said. It gets to be a long story, but I'll try to cut it a little bit. But basically, yeah, it's been a journey of self discovery. I initially went to medical school because in my house, academic success and job security was a value in my family. Um, I think in medical school, I realized that I wasn't as excited about the practice of medicine as some of my colleagues, but I didn't know how to pivot. I was in debt. I didn't think I could. But while I was in medical school, interestingly, we had a choice to take electives. I took a chronic pain and meditation class, thought it was really interesting. And then when I was in residency training for pediatrics, I had a chance to go study abroad in Thailand, and I was looking at trying to investigate alternative practices there and didn't really come across much, but I heard about some travelers teaching Reiki, and I had never heard of it. But I went and I got trained in some basics of Reiki. And so that was back, late 1990s, 2000. And then continued on that Western medical path. My favorite part of medicine was my relationship with my patients, but I really didn't like the medicine. And then I developed my own chronic pain journey. And I never wanted to be my own doctor, so I didn't want to be defined by my pain. I didn't join chat groups. This was a long time ago, different forums. I didn't
Mm.
join that. But if someone told me to go try this, I would try acupuncture, which I do think is great, but wasn't helpful for me. Try magnet therapy, whatever they told me, I listened and followed. But anyway, and then I finally was looking to leave medicine, and Reiki kept appearing back in my world. I kept getting signs for it, and I got recertified to a higher level a few years ago. And then I was sent this Washington Post article in 2021 about pain reprocessing therapy. And it made so much sense. It was founded by MDs, which I'll get into. It's evidence based. And it made so much sense. But I was actually really afraid to try it because I had had so much hope for so many things. I had tried all these things and always had hope, and my hopes always got dashed. But I decided it just made too much sense, and I started seeing results like immediately, and got to know people that were having incredible dramatic results. And so I decided to get trained in that as well, and pain reprocessing therapy, and yeah, just continuing on that journey and seeing where it takes me. But I'm so excited to share it with your listeners, all this that I've discovered.
This is great, and such a compelling story. So, for those people who may not know what Reiki is, can you just give like a quick overview of what it is and how it helps people?
Sure. Reiki was founded in Japan over 100 years ago, and it is therapeutic touch. So it's not like massage. Basically, we lay hands either on directly on people, or actually can hover above, and it helps clear the chakras. And I know it sounds woo woo out there, and I can't always explain how it works, but it actually has been shown via evidence to reduce stress, promote healing and wellness, can help with some aches and pains. And amazingly, like a lot of the major cancer centers, including MD Anderson, give Reiki adjunctively to their patients while they're going through chemotherapy.
Wow. So, as I'm recovering from my hip surgery, I go to, and I know we talked about this beforehand, I go to this guy that I can't explain what he does. It's craniosacral massage, and it's
Hmm.
not like a spa massage or anything like that at Canyon Ranch. It's like you're wearing your sweatpants, and he just does stuff, and he like touches me in different places, like we're trying to get some pain in my right knee worked out, and he's touching, like, under the left side of my back, and I'm
Right,
kinda like,
right,
I don't know what he does. I can't explain what he does, but I know it works, and I
right,
pay out of pocket for this because
right.
I know it works. So it sounds like Reiki is, like, somewhat similar in the approach.
Yeah, hard to explain, but I mean, I've had patients, I mean, again, it sounds out there, but I've had patients like, I mean, their faces are transformed when they leave, like a deep sense of healing and peace. I've had patients who, were like able to like really like had deep inner child healing, like cry on the table and like hear from their inner child that they were enough. I mean, it really is, yeah, and also like heal some aches and pains and things like that as well.
Yeah, and for the people who know me, and Debbie, you can ask your sister, I am, like, the least woo-woo person out there, and
Right.
I swear by this guy. Like,
Yeah, that's awesome. I've heard great things about craniosacral.
yeah. Alright, so alright, so now you've talked a little bit about Reiki. You've talked a little bit about your experience with chronic pain. Do you think that started as a result of, like, the stress you were dealing with since you didn't you were talking about being in medicine, but realizing, like, this really wasn't my true calling"? Do you think that any of that was, like, kinda linked in there?
You know, that is a great question. I think there is so much that is multifactorial, and what a lot of these doctors are finding that are in this mind body medicine work, which is what pain reprocessing therapy can help with, is they're finding that people who have it doesn't have to be that you've experienced like major T, capital T trauma in your life, but the minor T trauma, and not to go into so many personal details, but, things like bullying, things like feeling left out, comparing yourself to others, being highly perfectionistic, people pleasing, those kinds of personalities, highly sensitive people, often can predispose the body to chronic pain and other chronic conditions because our brain is looking for a way to protect us. Our brain can get stuck in fight or flight mode. And if we feel constrained or trapped by those other emotions and aren't allowed to express them, then our brain is kind of like shouting a message to us.
I feel like this a lot with, like, when I'm talking to my time management, clients and helping them with accountability is that you don't realize how much stress that you're carrying until all of a sudden you're able to eliminate the stress. Like, I have a good friend who went through a divorce last year, and when the person moved out, all of a sudden it just felt like this huge weight
Hmm.
because they didn't realize how much compensating they were doing with this
Right.
other person in
Right.
their home while
Mm.
everything was going on. Like, you don't realize, and I think that that adds up to inflammation, and especially with someone with autoimmune, right? Like, all of these things just add up to, like, really hitting at your immune system. And I mean,
Right.
obviously, I'm not a scientist, I don't play one on TV, but I certainly think that once I took steps to eliminate a lot of these stressors in my life, I don't think it was a coincidence that a lot of my symptoms lessened. They didn't go completely away, but they lessened quite a bit.
Right. That makes total sense. Yeah.
So, you talked about pain reprocessing therapy. I think a lot of times when people talk about pain management, yeah, people hear about acupuncture and then there's dry needling, but a lot of times it's pills. And
Right.
I feel like our parents' generation, that's when the pills became like a lot more of a thing. Like, oh, there's a pill for this. Great, I'll
Right.
take it. And I feel like I'm not a pill popper. I mean, I'm not against pills. I had to take a whole bunch post surgery, but as soon as I could get off of them, I wanted to be off.
Right.
So, talk about how pain reprocessing therapy is different than maybe what people think of when talking about pain management.
That's a great question. Yeah, and I have not abandoned my Western medicine by any stretch. I am still, fully on board with, seeing doctors, getting vaccines, taking pills when necessary. But pain reprocessing therapy and this body of work, which has a lot of nebulous names, neuroplastic pain. Some people call it TMS or tension myositis syndrome. Mind body medicine. So there's just all these different umbrella terms that kind of mean the same thing, but basically, what it is the idea, again, that our brain is trying to protect us, that all sensations of pain, whether structurally caused or not, are actually generated by the brain. that our brain has to send the nerve signal to decide. Like, for instance, in the military, if someone's hurt in combat, they will often say that they didn't feel any pain till they were able to get to the hospital, right? Like the brain knew, oh my gosh, this soldier needs to get to safety. And the brain will decide not to send a pain signal, right? So all this pain is generated in the brain. And the belief with mind body medicine is, without even pills, without any medicine or surgery, you can actually retrain the neurons, retrain the brain to not perceive those pain messages or what other chronic disease messages that it's sending. You can perceive it through a lens of safety, and it will actually rewire the neurons in the brain. And this has been proven by functional MRIs and other studies. Like, the parts of the brain that light up actually change, which is so exciting, and can actually be retrained so that you can feel that sensation. You might still feel it, but you can tell yourself, like, oh, wait, that's not dangerous. And literally the pain will lessen or go away over time of doing this work. It's really dramatic and incredible.
So when I was telling people that I was bringing you on and talking about this, the number one question I got, and I mean, it isn't even close, was I have degenerative knees. How do I know that this is the right thing for me? And, what do I still do about, talking about like the Western medicine and the alternative medicine? Like my knee's still degenerating,
Right.
but there's still the pain. And obviously, you try and put off these replacements for as long as possible. I should say this. This is meant as just informational. This does not constitute medical advice or practitioner advice. Let me just make that clear, and it will be included in the show notes. So, hypothetically speaking, someone comes to you and they're like, I got degenerative knees
Right.
and I have a lot of pain and I'm going to like get the injections and blah, 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 blah. How do you work with someone like that?
So that's a great question. Again, a lot of pain is learned association. Like, we're told, oh, we should be in pain. Oh, our bodies get old. Of course, we're in pain, right? The way that Dr. Schubner and a lot of these experts have looked at it, they have seen that basically even people with like bone on bone degeneration, like, there's many people that have evidence of those things on x-rays and MRIs and have zero pain, right? So just because you have that on a find doesn't mean that you have to have pain. And they actually say that the degeneration is a normal part of our aging process. It's like a wrinkle on the inside. So it's like a wrinkle on your knee, right? Your wrinkles aren't painful on your face. You might not like the way they look, but they're not painful, right? So if we can think of it that way, then and to know and like to know, and I'm bad with statistics, I can look at it, but some research findings on MRIs found, let me just double check the statistic here. Oh, just like, you put that 64% of people without back pain in this New England Journal of Medicine study have disc bulges, protrusions, herniations, or disc degenerations and have no pain. 64%, right?
Wow.
Yet how many people do we hear say, oh my gosh, I have to go, I've got pain, I'm going to get slip disc surgery? And again, I'm not saying don't go get surgery, but what I would say is, hey, like, this doesn't this doing this work, there's a lot of free ways you can access this work. Like, why not give it a chance? Why not see if it produces some relief over a few months' time before you jump to surgery?
Yeah, I mean, I was bone on bone with my first hip and I was close to it with the second hip. And I didn't feel like I was in pain, but I kind of like ignored it. And then only thing that was like a symptom was that I couldn't put my left sock on without my abs spasming. That was like the only clue that that was like a problem, and it was painful. But walking wasn't fine. But when I got the diagnosis, everybody is like, I don't even know how you're functioning. So then, of course, I get the diagnosis, the surgery scheduled, and all of a sudden, every day, it's, oh my God, I'm in so much pain. This sucks. When the hell is surgery? Meanwhile, like, I had been
Right.
totally
Right.
ignoring the
Right.
pain.
Isn't that fascinating? Or maybe you weren't feeling it in the same way until it
Yeah.
was suggested to you that you should be in pain.
Yeah, well, the thing is that when I got the diagnosis, I didn't there was nothing in my mind told me I was gonna need my hip replaced. Like,
Right.
that was not even on the table. Everyone thought because of how I was moving that I might need a cortisone shot.
Mm.
And when they were like, "You're bone on bone," and I'm like, "That doesn't sound good."
Hmm.
But I think it's fascinating because just from like, anecdotally from my experience, I didn't think I was in pain until then it's like, "Oh, yeah, I'm supposed to be in pain, like, I have no
Right.
cartilage." So
Right.
But I think the other thing is that, and for these people with the knee problems, most of them are in their like 40s. And
Right.
so they don't, first of all, knee replacement surgery is a lot more complicated than hip replacement surgery.
Mhm.
And they don't want, they're worried about having to have it again because of how
Right.
long the devices last. So I think what's
Right.
really great about what you're talking about is the fact that if you can kick the can down the road safely, right? As again,
Right.
you're not saying like don't get the surgery, but if there's a way you can kick the can down the road safely so that you don't have to get yet another set when you're
Right.
older and probably more frail,
Right.
that's a positive thing.
Right. And maybe they would never need it perhaps with these
Perhaps.
techniques.
Yeah, I mean,
Yeah.
you don't know, and you don't know what other kind of therapies can come out that can help like
Right.
regenerate cartilage or, all of these things. Like you just don't know. But just for people here, the New England Journal of Medicine, would you say that's like a gold standard in terms of like when you're talking about research and studies and
Oh,
everything?
right. Yeah, that's absolutely one of the pinnacles of medical journals for sure. I mean, this is legit work, and that's what really impressed me with all this is these are real medical doctors that are pioneering this work. It started with a guy named Dr. John Sarno, and then there have just been a whole bunch of people since then doing more and more studies. And it's not mainstream yet at all, but it is becoming more widely known and accepted. And that's why I'm doing this podcast, even though I'm nervous, because I would love for people to learn about this work.
Well, you're doing great. You're explaining
Thank
things
you.
very simply for everyone. And I think that's the whole point of this is to make it accessible so that people can be educated. So that's a good segue into this. So does insurance cover this?
No, it's a great question. In certain places like Colorado has a lot of the research, a lot of people in Boulder are looking at this. And yes, a lot of insurance companies in Colorado cover this. A lot of places do not.
Do you know if people are able to use like their HSA funds for this? Have you heard about that? And if you don't know, that's fine. I just,
Yeah, no, it's a great question. I mean, I would think, a lot of people doing for instance, pain reprocessing certainly is a lot of times coaching and therapy that they might be able to Reiki again, I think if people would have to check with their insurance.
yeah. Because I know that there are things that I see covered under HSA that aren't as medical as pain reprocessing therapy. And
Right.
so I would be curious about that.
There also are a lot of, like I said, there's a lot of free resources on YouTube. I mean, you could Google pain reprocessing therapy. There's a guy, Dan Buglio. A lot of people, again, I don't know these people personally. I'm not,
Uh-huh.
getting anything for promoting them, but a lot of people really resonate with his podcast. There's a woman, Nicole Sachs, who does a lot with journal writing in a unique way that a lot of people heal just with journaling.
Uh-huh.
There are other resources to like podcast. Pain Psychology Center has a bunch of things. So I mean, there's a lot of free resources out there that I could give you links later if you'd
Yeah.
like.
Yeah, we'd love links for the show notes. I think we talked about like this journaling technique where you just basically word vomit and
Right.
then you just like erase it. I forgot what the name, I always forget the name of it, but
Yeah, it's called Journal Speak. This is
yeah.
a woman, Nicole Sachs, who's a social worker who had tremendous back pain. In fact, she had spondylolisthesis, which is the same thing the person who presumably assassinated the United Healthcare
Mhm.
um, CEO, that
Right.
Luigi guy,
Yeah.
had that as well, and he had undergone multiple, I think, surgeries and spiraled down from what it read in a pain thing. And she had that same diagnosis and was told she was going to be bedridden as a young woman for like the rest of her life, pretty much.
Wow.
Like pretty like not able to have kids, not able to do anything. And she met Dr. John Sarno and um, started journaling. And she talks about how her very first journal entry was, "I hate being a mother." And she couldn't believe she wrote it. She was like, had so much shame about it, but she's like, "I really don't hate being a mother." But there were aspects of that identity she hated. And just being able to admit it on paper, she actually had a dramatic recovery. She said within a few days, she was like so much better, which I know sounds hard to believe. Like, how can you just write and all of a sudden? But she has, I mean, I know people who have had dramatic success just from journaling, which again sounds kind of woo woo, but hey,
I mean, I think there is an element to it. When I left corporate, I went through some things, went to therapy. And, the homework I got in therapy, involved like thinking about something. And so for me to think about it, and I have to write like, type. And but I wanted to like do some research on the question and really think about it like holistically. And then it led me down to reading this book about forgiveness. And that book, I was like, I read the book and I'm like, okay, I'm done. Like, it just allowed me to get
Right.
to a
To feel
different
the
place.
feelings.
Yeah.
Yeah.
And it allowed me to kind of take some ownership as well,
Mhm.
which
Mhm.
I think is also important when you're going through some kind of therapeutic process. Like you think you're a victim and everything else. Like I didn't do anything to get autoimmune, for example. But the reality
Right.
is that this is the hand I've been dealt, and I have to take some ownership around like, what am I going to do with this information? Like, I am now informed. What do I do? And so I do believe that there is some element, like, it's not going to cure you from cancer, right?
Right.
But I do think that for a lot of things, there is that element of that alternative medicine in conjunction with Western medicine.
Right. Yeah, speaking of the alternative, I mean, of the autoimmune disease, I had a chance to meet with one of the experts in this field named Dr. Alicia Batson, and she had talked about, this work is great not just for structural, joint pains and back pain and all that, but also things like POTS, which is very common these days, long COVID, irritable bowel syndrome, fibromyalgia, various like paresthesia, numbness, tingling, all sorts of things. But one of the people in this cohort I was studying with, he had Parkinson's, and he was asking, well, what about my Parkinson's, and could this still be helpful? And what she said to him, and what I've heard from many people with autoimmune and other chronic diseases, is if there's a portion, a percentage, a subset that is, the pains and symptoms are exacerbated by that stress, by that mind body component. If you could even make a portion of your day-to-day symptoms better, wouldn't that be worth it? And for his belief, it is yes. And my goodness, I just spoke with him yesterday, and it's like his life is dramatically different than when he started this work 2 years ago.
Yeah, I mean, it goes back to I was able to reduce a lot of like the flare-ups with my autoimmune
Right,
by just like figuring, and now I did it on my own and I kind of just like figured things out, which is also why I started Go Long, was to help people short
right,
circuit that process so they can learn from my mistakes. But I think that conceptually it's what can you do to eliminate the clutter, and the clutter is what causes that inflammation. So I think that the autoimmune part is really interesting because stress exacerbates autoimmune, like it does. And it's a vicious, the problem is that, and I lived this like 20 years ago, is that it was like just this vicious cycle. And it's really hard to get out of it.
right,
And it was hard for me to break out of that cycle and to go against the inertia to figure out, like, okay, I need to like take a step back. Because as you said, growing up, a lot of academic achievement, a lot of stable, like good job, good future, like all that talk, right? And it's hard to stop and being like, oh, I'm taking a step back. No, that's not
right.
cool. That's not good. What's
And what
wrong?
does a step back mean
Yeah,
anyway, right?
well,
Like, why do we call it a step back? But that's part of the perception that leads to some of the stress, right?
yeah, exactly. It's like
Yeah,
you didn't feel like, and I mean, I think we're like roughly the same age. So it's like at that point in time when you were in medical school, like, yeah, taking a step back. No, that's
right,
like, there's something wrong with you.
right.
And,
Yeah,
as opposed to being like, "Yeah, you know what? Like, let's focus on how you can rechannel that. How can you
right.
reorient that?" And, so I think that it's really great that you've been able to do that because I think there's a lot of value you have with the Western medicine and the alternative treatments. So maybe you can go into a little bit more around that because I think that there's a lot of people who practice this pain reprocessing therapy and Reiki, but
Right.
there probably not many of them are MDs who like worked with patients for 20 plus years in a clinical setting.
Actually, and like I said, more and more the work is being pioneered by MDs who are doing this. Like Dr. David Clark, he was a gastroenterologist, and he was being sent like problem
Mm,
patients that no
right.
one could figure out with like terrible abdominal pains for years. And he he was sort of surprised, but just by talking to them and
Mhm.
like finding out some stuff, they were able to start getting better. And so he was then became known as, one of the the people go to send your difficult patients to, and they had so much success. So now he is, founded one of these centers where they do all this work and study that. And a lot of the big names in these works collaborate with each other. So I'm not unique being an MD, but yes, it is definitely not the mainstream that people do it. But like I said, there are people out there doing all sorts of research, looking at the brain, looking at other ways pain shows up, and I can tell you a few other studies if you're interested. I think they're interesting, so
I mean, we could link to those in the show notes because I think that that's good because what I want to do is also talk about like there's probably a lot of myths out there. There's probably a lot of naysayers out there around both Reiki and PRT. So, do you want to address some of those things? Because I'm sure they're out there. So, I want to give you an opportunity to kind of say, here's what's really happening.
yeah, I mean, I think the myth around this work, I think there's a lot of people that might say, like, again, that this is all like woo woo, or that the pain is in your head, that you're being told the pain is in your head, it isn't real. I've never, and the people that believe in this work are not saying the pain is in your head. What we're saying, and there's a distinction, the pain is in your brain, right? So the pain is real. You are having those pains. No one is not saying that you're not having those pains and experiencing all those things. We're saying is that your brain is stuck in fight or flight mode, is stuck in fear, and your brain can be rewired to say, you know what, I don't need to react to that symptom, that fear. I can actually be okay in this. And so you will potentially continue, even if you do this work, you'll continue to, life keeps lifing, you will continue to get pains, but it's the way you choose to react to them that can be different. And that this work is pioneered by MDs and is completely evidence based, I think is really important. That's what sold me on this work, that and the evidence that it worked for myself and my friends.
Hmm. What about Reiki? Is there anything that from a myth perspective that's out there? Like, I'm sure there's plenty.
I mean, I don't know all the myths. I do know it's laughed at. I'll be watching shows. I think it was like made fun of on White Lotus.
Uh-huh.
It's made fun of a lot in the
Uh-huh.
popular culture. So yeah, I'm sure the myth is like, what is it? It's so stupid. But again, I've seen for myself, and I've seen I mean, I have so many return clients that I mean that come all the time and just feel a dramatic sense of healing. So I think that speaks for itself. Yeah, but I think there probably are a lot of myths out there.
Yeah, I mean, like I said, the way I talk about the massage therapist, the craniosacral guy named Sam, who is great. And I told him I don't know how to describe what he does. He's like, "That's all right. I can't describe what I do either." And I'm like, "Okay, good.
Right.
I don't feel so bad." Because I wouldn't want him to think I disrespect what he does.
Right.
I'm like,
Yeah.
"Dude, I pay you out of pocket.
Right.
So
Right.
clearly I respect what you do." And I mean, that's the thing. You have people who are paying you out of pocket because they believe that you provide some value to them, and that's to
Absolutely.
not be in pain. So, what advice would you give someone who's skeptical? Like they're kind of like, is this like a social media fad? Is this a social media
Right.
influ? And I know you're not like a social media influencer
Right.
type person, but if someone is skeptical about it, but they're kind of curious, what advice would you give them?
Yeah, it's a great question. I would just say if you have an open mind, and I mean there are so many podcast testimonials, like, and again we can link to them, but like a lot of these um experts in the field have testimonials on, and you'll hear stories, like dramatic stories of people that had migraines every day for years, or long COVID, bedridden, and with so many symptoms, tinnitus, chronic fatigue, all of that, and then it's gone, or like dramatically improved. I mean, and like story after story after story. To me, that combined with the research, that to me, it's like, why not try it?
What about with someone, I haven't, a couple of clients dealing with PCOS, and
Okay.
obviously there's a bunch of people in this community who are dealing with menopause. Do you see, PRT helpful, particularly with, PCOS, right?
Right. Um, it's interesting. I haven't heard that specifically with that diagnosis. I know someone with endometriosis who's had a lot of help, and a lot of pelvic pain is very common in this work, and a lot
Right.
of people dramatically improve from various pelvic pain. So I would imagine it could help somewhat. I mean, menopausal symptoms sometimes. the brain fog and the sleep issues. A lot of people. I will have to say that's one area. The sleep is still a little challenging for me. My own chronic pain has dramatically increased. I still am not the greatest sleeper.
Mhm.
So, it's a work in progress, but a lot of people I know have had dramatic success with sleep as well with this.
If someone is contemplating going for pain reprocessing therapy, how many sessions do you have, like, an idea, like, in terms of setting an expectation? Like, I'm assuming it's
Right,
not a one and done.
right. Right. There's a great question. I mean, I actually started this work through an app, and again, I get nothing from it. I'm not associated with. It's called Curable,
Mhm,
and I think you can do a 2-week free trial.
mhm.
And I started, and it has different components where it's a you get to choose whether you want to do like a meditation, a visualization, a writing exercise, or listen to education, which helps retrain your brain. And so you get to choose, and it's at your own will and at your own time, right? And so, that's where I started, and I saw dramatic improvement just from the app. So, you don't even necessarily have to go the route. I think it depends on what your learning style is. Like, if you feel like you wanna be guided more, you want that relationship with a practitioner, and that's a more costly option, and I can't really say. I would imagine you would need at least a few sessions to learn the techniques, and then depending how much you do on your own and what success. But like I said, I know a lot of people who just healed with YouTube videos or journaling.
Mhm. Okay. 'Cause because I always wanna be clear with people. It's like, "Hey,"
Right.
it's not like one session and you're
Right.
magically everything
Right.
goes away. I mean, like,
Right.
you're not gonna
That's the
go to
unusual case.
yeah, like,
Right.
you're not gonna go to therapy of any kind,
Right.
and
Right.
then magically everything's okay for, forever. So, I think that that's helpful. Is there any type of certification, that people should be looking for both we'll start with pain reprocessing therapy first, and then we'll talk about Reiki.
That's a great question. I mean, I trained through the Pain Psychology Center, and I actually have a certificate in pain reprocessing. I think there might be one other center that's doing it now, but I would ask people if they have a certification in this work.
Mhm. And then with Reiki, I see a lot of Reiki in my feed,
Right.
but
Yeah, the same thing. I mean, there's different levels of certification. I would ask people if they've been certified, and the highest level is master level. So, if you want someone who has had more experience to ask if, they have a Reiki master certificate.
mhm. Do you feel it makes a difference between someone who maybe has, kinda like in judo, right, or karate where you have, like, a white belt versus a brown belt versus a black belt? Is that a thing where you're like, it definitely makes sense to get to someone who has this level, like, in the Reiki,
It's
hierarchy?
interesting. Yeah, in the Reiki. I mean, I think it's just a question of how much experience and how much they've done. I feel like my practice has strengthened over time. I don't think it would be harmful, but maybe they might have a better experience. But if someone's highly intuitive, I think, if the person seemed like they like their vibe and they trusted them, it's not like they're, it's just the laying of hands. Like
Mhm.
I don't, sometimes people feel a little worse after the session. It's very unusual, but sometimes you're, detoxing things and might feel a little icky, but in general, nothing bad is going to happen. So,
Well, I mean, sometimes you can have a massage, you can have a headache because like a regular massage where, they're moving things around and I mean, they're like,
right,
drink a lot of water because
right, exactly, right,
so, I mean, I don't think that's necessarily a red flag, but,
right.
okay, so that's helpful. Where do you see let's talk about the future. Where do you see the future of pain management heading?
Yeah, that's a great question. I mean, I don't have a crystal ball, but some of these experts put together, I'm looking up the name, a YouTube video just recently that came out, and it's called Pain Science Paradigm Shift. And one of the experts on there said, like, she feels like one day we're going to look back at the way we were treating pain with all these pills and surgery as like equivalent to leeches, that, the way they use leeches to do whatever, all the things they did
Yeah.
with leeches, right? But that we are in a revolution, right? That like think that this if this work really takes off the way and gets the acceptance that it should, I mean, America spends so much money on chronic pain and so much resources on the chronic pain that I think, I mean, and the cost effectiveness of this is so much less. I think it would be dramatic.
I mean, I think it would be great. And obviously, right now, healthcare is a very fraught subject. And we're not going to get into the politics right now. But the thing is that being able to eliminate, chronic disease and chronic pain would be a huge win for us as a society because at Go Long, it's like it's not just going long, it's like going long with like quality and having a
Yeah.
quality of life. Like if you're living until 90, but you're bedridden for the last 10 years of your life, is that really what you
Right.
want? And I mean, and obviously that's a personal decision for everybody. But to me, I want to be having a party on my last day. Like I want to go out, having like a huge party and it being like, all right, that's it. Game over.
Yeah.
Right. Like,
Sounds great.
like I want to be like hiking or, doing the things and being outside and doing the things that I love with the people that I love. So I feel like a lot of that like chronic pain and like that over medication that we tend to do here, like my dad, every time he goes to the doctor because he's sick, they give him another antibiotic. And I'm like,
Right. Give it some time. Give it some time. Let's see what happens, right? Yeah.
he's like, I got a Z pack. And I'm like,
Yeah. Sounds familiar. I can relate.
yeah. And so
I won't name any names or
we
anything.
won't, well, I already named my dad, so that's it. The cat's out of the bag. But, um, but the thing is that it's more of, figuring out what's appropriate. And I mean, even so, the whole thing about pills, I was taking a whole bunch post hip replacement surgery. They had me on multiple painkillers. And yes, I was in some pain. The blood thinner, they had like the stool softener, they had, anti-nausea stuff. And there was something, at one point I was on 8 different medications, plus
Wow.
taking them multiple times throughout the day. And one day my body was just like, fuck off. Like it literally just like I had this headache and I couldn't take anything because I was in between my pain medications. Like I can't take any more. And I really think my body was just like rebelling because it was obviously healing from the surgery because it was about a week and a half after surgery. But also it was just processed like pills. I have to think like your body processing pills puts more stress on it because it's not like a food, right? It's like,
Yeah.
and so I have to think it just puts more stress on like your kidneys or something. I don't know. I just, again,
Yeah, might. Yeah, it's a good point.
and so I just was like, yeah, this is why I don't take a lot of pills because like I don't think my body likes it.
Mhm.
So, all right. We talked a little bit about some of the resources where people can find more information. Do you have any other resources that like you love or any recent articles that have come out that you want to call attention to?
Like I said, I think that like the curable app, some of the podcasts, I'll get the specific links for, but those are the ones that I think probably for me are the most helpful. There actually was an interesting, I think I told you this when we talked earlier. There was a huge op-ed in the New York Times recently about needing a revolution for pain, and it was a Sunday piece. So it was really long, and they talked to researchers at Stanford about some of the latest research and all sorts of stuff. And this pain reprocessing wasn't mentioned at all. It made me sad, and I tried to write a letter to the editor. It was not published, but yeah.
If you want to include the Google Doc, I'll link to it if you want. I'm happy to do that. So,
Okay. Get my publishing.
yeah, I'll get it in. I mean, we're very high tech here at Go Long. It's all about the Google Doc. But I do think it's really important. And as someone who has just gone through like, a pretty serious surgery, I do think that there's a lot of merit in what you're talking about. And I want people to know that there's other options that they could at least explore. And
Exactly.
it may not be the right thing for them for whatever reason.
Right.
Again, this isn't medical advice, but what I try and do on this show is to educate people so that they can ask their doctors and their medical teams informed questions because you know this from when you were practicing clinically. If you're lucky, you get like 10 or 15 minutes with your doctor. And if you don't go in there prepared,
Right.
and it's not the doctor's fault, it's the system, right?
Right.
And there's a lot of problems with the system. We know that. And it's more of you got to go in there prepared because the doctor's like, all right, cool. All right, you good? All right, great. Here's the script. Called into your pharmacy.
Right.
Physician's assistant will help you. Okay,
Right.
next.
Next. Yeah, exactly.
And so I think that this is just another thing that people can get educated on and learn about in some of the resources. So I know you're not a huge social media person, but where can people find you in terms of just like, getting in touch with you if they had more
Right.
questions?
That's a great question. Right now, I think probably the best way would be LinkedIn, which I just started using to promote this work. Debbie Sumner, MD.
Yep.
Um,
We'll link to
but I
that.
haven't, yeah, I haven't really, put myself out there on Instagram in this professional type level yet. Maybe in the future, but for now, not so much. So
Yeah, we'll put the LinkedIn link there, and people can get in touch with you there. And, I just think that I really appreciate you coming on and talking about this. I think that, we try and be open minded about all different types of ways that, women 40 plus, especially with the autoimmune, can advocate for themselves. And, I think there's a lot of gaslighting that happens in the medical field.
right.
And
Mm-hmm.
and in some ways, the pain when you said like it's not in your head. Well, it is in your head, but not in that way,
Right.
right? It's
Exactly.
not like this made up pain.
Right. Absolutely.
It's something that you're
Right.
feeling,
Absolutely.
but because it's hard to articulate, it gets like poo-pooed
Right.
away
Exactly.
and dismissed. So, we actually have a series that my husband plays Dr. Dismissive, and it's kind of, and actually, another
I
cousin.
shouldn't laugh because
Okay.
I've been there. I've been dismissed myself. It doesn't feel good at
No,
all.
it doesn't. I'll send you some of the Dr. Dismissive videos, but, then, um, the, gentleman who helps me with the show, he actually said, "I think we should rename him Dr. Dipshit." And, so we're negotiating that and everything, but I want people to know that they should be advocating for themselves. So this is a really great conversation. So Debbie, thank you so much for your time. Really appreciate you sharing your knowledge and your expertise. So thank you so
Yeah, well,
much.
thank you. Honestly, I thank you for taking a chance on me, and I appreciate having the platform to talk to people about this work because it's meant so much in my life personally and now professionally. So,
Awesome. All right. So with that, I want to thank everyone for tuning in. This is Going the Distance with Go Long. We're here with Dr. Debbie Sumner, Reiki practitioner, pain reprocessing therapy guru who, you know, I don't know if guru is the right word, but
sounds great. We'll
sounds
take
great.
it.
We'll take it. All right. So with that, so again, Go Long is around helping women 40 plus, especially with autoimmune, deal with all the things. And yeah, so thanks for tuning in. Remember, it's your life. Go the distance. Go long.
Bye.